you call that line? Now, that's actually due to this. So here along, what's this thing? Diaphragm. And this is very thick. So this is our purchase line. And that's what is responsible for producing this type of effect when the animal is breathing. Now, when you have thieves, this is an allergic kind of reaction. Actually, I guess the equine asthma kind of deal. But when they have this, what's the big problem? Getting the air in or getting the air out? Out. Because remember, inspiration is what? Active. Actually, you have muscles contracting in order to do that. Which muscles contract to facilitate inspiration? The intercostals, and what else? What else? The diaphragm. So that's what allows you to get air in. But inspiration is passive and is due to what? The elastic recoil of the lung. It's coming back to your physiology. All right. So that's what it looks like microscopically, what the lungs look like. And one of your classmates asked the question, said, well, you see all of these eosinophils in cats and really in humans too with asthma. But in horses, you see a lot of neutrophils. Why is that? Well, it's really because of the difference in the types of, in the number of a type of cell that's present. Horses don't have as many mast cells in the lung, and as a result of that, they don't attract as many eosinophils as do cats. Cats and humans have more mast cells in the lung, so they get more of an eosinophil response. Okay. And hyperplasia, this is increased numbers of cells. And this is a schematic that kind of defines what's going on. It's actually an experimental kind of situation where they used a rat and they took a piece of the liver out. That's the partial hepatectomy thing. And then they measured these various hormones and factors so that they could find out, what happened as a result of trying to repair that. So this partial hepatectomy actually is the priming kind of thing. And then from there, you get the proliferation. And here are all of these factors that participate in proliferation. So as this is occurring, what do you have to have in place? You got to have this in place too. In other words, you got to have a way of slowing it down. If you didn't, what would happen? Uncontrolled proliferation, and by definition, that's what? Neoplasia. Controlled proliferation is hyperplasia. Uncontrolled proliferation is neoplasia. Okay. So, some of the important things to remember here. One of the big deals as far as proliferation is concerned is tissue growth factor, and alpha is the one here, and the one that controls that is tissue growth factor what? Beta. Okay. So make sure you remember those. Now let's look at some situations that are examples of this. Now this wasn't partial hepatectomy. Actually, this horse had a disease affecting the liver, and it damaged this part considerably, and this part underwent hyperplasia. And if you look at them histologically, over here, there's a lot of connective tissue. How do I know it's connective tissue? This blue stuff is part of a special stain that stains collagen. And over here, this is the hypoplastic part. Now, do you think this liver is working right? Look at it over here. Where is the portal triad? You see it? No. Are the cells lined up in nice cords like you see? No. So as a result of that, this doesn't really function like it normally would. So the animal is not, even though he's trying to compensate for not having enough over here, this proliferation is not really helping them all that much. And here's another kind of proliferation. This is in the adrenal cortex. And this is referred to as nodular hyperplasia of the adrenal cortex. And that's what it looks like. Yeah, you see this area here. That's it using the ultrasound. And histologically, it's just a proliferation of cells. You seen this before? Have you seen that before? Well, not this particular slide, but have you seen this before? What'd you do in endocrinology? Huh. One of the things you're going to learn is that you have to apply everything you learn everywhere. Endocrinology is not over there in the corner just for endocrinology. It's something that you apply everywhere. Plan path, all of that stuff that goes along with this, you're going to apply, okay? Because it helps you find out what's wrong with the animal and what to do to try to fix it. Okay, now hyperplasias don't have to be due to disease, they can be physiologic. And this is showing uterine endometrium during the estrous cycle. So it does undergo hyperplasia too. And that's just showing that the other thing was a schematic going through the various phases. And this is actually showing you what it looks like when you look under the microscope. Now you can have hyperplasia that occurs as a result of response to drug therapy. And this is what this is indicating. Here's a drug, acetaminophen. Now, what happens to this drug? When you take it, it does get metabolized by the liver because it's usually an oral preparation. So it's coming through the portal circulation from the GI tract to the liver. And the liver is metabolizing it. Now, in the process of metabolizing it, you can end up with toxic intermediates like this. And these things will actually cause tissue damage. However, you do try to get rid of that and export it from the body. So you do have means of counteracting this, but if you don't counteract it, or if this overwhelms the ability to get rid of it, then you end up damaging the organism. So this is what this looks like in an attempt to try and metabolize this stuff. This is the smooth endoplasmic reticulum, and that contains a lot of the enzymes that participate in this. This is where cytochrome P450 and all those kinds of things reside, is in the smooth endoplasmic reticulum. So this undergoes hyperplasia. Now, this particular liver cell hasn't duplicated, in other words, it hasn't proliferated, but it's gotten bigger. And within this cytoplasm, there is actually hyperplasia of the smooth endoplasmic reticulum. And what does that look like if you look at the liver? Now, these cells are bigger in this liver. So the liver itself is going to be bigger. Now, I tell you, you told when you had a big liver, what kind of edges?
The edges.
Rounded edges. This is a big liver, rounded edges. And when you actually look at the cells, these cells are bigger. And if you looked at that with EM, you can see that this is why they're bigger. And this is to show you more detail about what can happen as far as the metabolism is concerned. This is going through the same process where you end up with this toxic intermediate here. Now, what can happen with that is it can affect the mitochondria, and that can lead to activation of the caspase system. You say, what is it? What is it? We'll learn about that when we start talking about apoptosis as part of cell death, programmed cell death. And the other thing is it can actually damage the mitochondria to the point that you end up with decreasing the amount of ATP that they produce, and that of course can lead to cell death. And that's referred to as accidental cell death. Necrosis, or a newer term that we use, is oncosis. It's still the same thing, it's not different. It's just a different name. So that's defining what's going on here with this toxic type situation. And that's just showing it again. Actually, I had a couple of pictures to put in this thing, but I didn't get them in there. Okay, so you've seen this before too, even though you didn't realize it. Here is the thyroid, and where do you think the arrow is pointing to? What's that thing on the tip of the thyroid? What could you not find when you were down in gross anatomy looking for it? So this one is very visible. All right. So what is it? Hyperplastic. And why is it hyperplastic? Look at this kidney. Is this a normal looking? Is this a normal kidney? No, it's not. So this kidney is chronically damaged, and that means that it cannot excrete phosphorus properly. And as a result of that, the phosphorus that is remaining combines with calcium. Now, what is the body looking at as far as understanding how much calcium do I need? What does it look at? Does it look at ionized calcium, or does it look at combined calcium? What's it look at? Ionized calcium. The free calcium is there. So if you tie it up with phosphorus, what does the body say? I need more calcium. So how does it get it? Parathyroid glands undergo hyperplasia. They release parathormone. And what does that stuff do? It restores bone. Activates osteoclast. It restores bone. Okay. So this is showing chronic renal damage. You had hyperplasia here, which resulted in bone resorption. And what's wrong with this little dog? It's not a little doggy, the old dog, really. Okay? What's he doing? Trying to poop. He can't poop. Here's an x-ray. Here's his bladder down here. What's all this stuff back here? Right at the neck of the bladder. What's all that stuff back there at the neck of the bladder? Here's the bladder. Here's something like that. That's a normal.
Prostate.
Okay, prostate. Let's back up again. All right. So there's the prostate. Now, where is the colon coming through here? Right up through here. If you got all of this sitting right there in the pelvis, is this dog going to be able to defecate? Nope. He's going to have a lot of difficulty in defecating. He also will have trouble in urinating. That's one of the reasons the bladder is so big here. So, as we look at it with ultrasound, we can see some of the area that is defined the way you can see it defined more clearly. This is the cystic area in the prostate. That happens when you do get prostatic hyperplasia. Now, when you see the term written, sometimes it's written as hyperplasia / hypertrophy. And why do you think it's that way? Let's look at the gland histologically. What do we got here? We have epithelium, which makes these glands, and there's also a fibromuscular stroma. A lot of smooth muscle is in there. Does the muscle undergo hyperplasia? What did we say? Hyperplasia is increased numbers. Does this smooth muscle actually replicate? No. It's bigger though. So hypertrophy. So that's why you see it written as hyperplasia / hypertrophy, because both components are participating here. The smooth muscle one is not actually undergoing hyperplasia. Okay. That's hypertrophy. And this is just showing you a big prostate. Very common in intact males once they get into their senior years. And that's true as far as humans are concerned too. And this is just showing that that's this one again, but it is a nice color picture. And where's the prostate and where is it? Where's the prostate? Which one of these is prostate? That or that? This one? Is that the prostate?
Yes.
Yeah, that's actually the prostate. That's the bladder back here. And that's what it looks like microscopically. And of course, that's H&E too. And the other one you saw was this is colored. The other one you saw was black and white. Other tissues that can undergo that are epithelial cells in the liver. That's a normal liver over here. And here's an abnormal one. Oops. I need a keyboard. That's one of the problems getting older. You get a big belly and you hit stuff. Anyway, these are actually bile ducts that are dilated. And that's why they contain hyperplastic cells. And if you look carefully at that, you will see things like this. This is a rabbit liver, and this is coccidia in the rabbit liver. And that's what's causing this proliferation. Now we're going to look at some other kinds of things associated with growth disturbances, hyperplasias, and so forth. This one is myeloid hyperplasia. This is showing a human skull where that has occurred. Normally the skull bone is not that thick. This is the medullary cavity there, and it contains a lot of red cells and white cells. And that's what it looks like, of course, histologically, and over there. This is the kind of response you can get to infectious processes. It's fairly rare, though, in people. Here's a fold that has lymphoid hyperplasia. So this is a horse. What's this? There's the tongue, there's the larynx. So what's this stuff? This is lymphoid tissue at the base of the tongue. And there's another place that this is too, right above this, in the area of the salt palate. So what is this whole area? Now in a human or a dog, you'd have one here and one there, and that's it. Starts with a T. Tonsil. Okay? So this is hyperplastic, and they don't really know exactly which agents are responsible for this. They suspect herpes in a number of cases, but that's not the only thing they ever find. And that's what it looks like microscopically. All of these hyperplastic follicles. Okay. And here's some hyperplasia of the skin. And this particular one is called acanthosis nigricans. And what's going on there? Well, in humans, very frequently this is associated with diabetes. So you have insulin resistance, which leads to insulin growth factor, insulin-like growth factor actually, participating in this. Somatostatin is also part of what goes on. And the end result is getting cells to proliferate because epithelial growth factor is actually stimulated by that. And you end up getting increase in the amount of skin cells, squamous epithelial cells. Now, seen that before? I got this from her. My slides usually stay right on top of each other, but she has stuff where it's fancy, they flip in and all that stuff, so that's why there's one now. Okay? So this is acanthosis nigricans in a dog. What's this one probably associated with? Now, I told you in humans it was diabetes. Is this one, well, it can be diabetes. But also you have thyroid problems in these guys. That will do that. And that's just what it looks like histologically. And this is other epithelium that is proliferating. This one is due to an infectious agent. This is in the bull. And these are warts that you find on the penis. And that's due to viral infection as well. Here's another situation where you can see proliferation. And this is on the tongue, but what we're showing here is an ulcer, and right at the edges of the ulcer you will see proliferation. And as we look at it microscopically, here's the proliferation that's occurring right along the edge, and right there the mucosa is damaged. And there's some more proliferation too that's going on. So this is in an attempt to heal. And that happens with ulcers, so you can get hyperplasia there. Okay. Yeah.
So that be similar to like a keloid?
No, because the keloid is just connective tissue. That is actually proliferation of epithelial cells. As a matter of fact, we'll show you keloids later on. What keloids are the epidermis. Proliferate a little bit, but not much. What most of that is due to is the underlying connective tissue. It's an exuberant response to healing. That happens in horses as well. What do you call that in a horse? Some of you people from Kentucky all know what that's called. You see horses